Teresa, did you get moved from Friday to Monday?
Oh, wrong class. Sorry.
Okay, I was going to say I have you on my Friday roster.
Yep, sorry.
No worries. Okay, let's have a few more people to come in. Let's just give them a minute or so and then we'll get going.
Are those all your books that you got in the background?
Um,
There's a lot of books.
do you want the truth?
Yeah.
It's my virtual background.
Oh my gosh, no way. It looks so real.
I know.
It's not, how do you do
I've had this
that?
background for 3 years.
Oh, I didn't
Mm-hmm.
know you could do a background.
Yep. Yep. Yep.
So you don't have that many books.
No. I have a library, but not that many books. Glene Glenesia? Glenesia. Do you go,
Yes.
would your name on the roster be Bates?
Yeah, I tried to get them to change it to Butler.
Okay, I just want to make sure. Just want to make sure. I have it
Okay.
as Bates. And then Celine. Did Celine come in? Not yet. Okay.
Yes, I'm here since a long
Oh, there
time.
you are. Okay. I have you as Broussard on the roster. Is that
Yes,
your
it's my other name.
okay.
I have
All right.
many names, as you can see.
Okay. All right. Just want to make sure. And then the only one we're missing is Lakeisha Jones. Did Lakeisha slide in here without me figuring it out? Okay. Okay. So, welcome. Welcome to week 3. Hard to believe it's week 3, but it is. Today we're going to take the quiz and then we're going to cover the content for week 3. If you see me looking to the side, I've got 2 screens going because I want to, when I share my screen, I want to go through the Canvas readings since there was no book readings this week, right? It was all in the Canvas readings, right? On migrant farm workers, rural populations, homelessness, and poverty. So I want to go back and forth between our Canvas reading and our week 3 blueprint notes that I sent. Make sure we cover everything, okay? And then I'd like to spend the rest of the class after we go through the content going through some test taking strategy tips and taking a look at the concept review guide that I sent yesterday or last evening. Okay, that's for the exam. So we're not going to do a review, but we're going to take a look at it and see how it's organized so that hopefully it will help you prepare for the exam. How does that sound?
That sounds good.
That sounds good to everybody? So for now, let's see. It is 3:04, so let's take 15 minutes. The quiz is open for you. So why don't everybody work on quiz 2? And again, you need to keep your cameras on. If you finish early, just keep your camera on. If you need to step away for restroom break or get a drink, that's fine, but just keep your cameras on. Okay, and then we'll regroup in 15 minutes. How's that? And make sure you hit submit when after you take the quiz. We can't review it until everybody hits submit. Okay, so go ahead and start that. I'm going to mute everybody just so there's no background. Actually, everybody is muted except me. So I'm going to mute myself, but get going with quiz number 2. Okay, how's everybody coming? I have 3 students that haven't got a couple more minutes. Danielle, you still working on it?
I just got one more I have to answer.
Okay. Alicia, you still working on it?
Yes, ma'am. I got 9 and 10.
Okay. And Lakeisha, still working on it.
Yes, I got one more.
Okay. Just let me know when you're done.
I'm finished.
Thanks, Lakeisha. Danielle, you done?
I'm finished, Miss Marvel.
Okay, thank you. And who else? Alicia, you done?
Yes, ma'am. That was me. I'm finished.
Okay, great. Great, great. Okay, well, I saw a lot of high scores on your quiz. So that tells me that you guys prepared well for class. So good. Let's review the quiz and we'll talk about it. I know a lot of it was on migrants, but let's review it. Okay. Okay, so what should the home health nurse anticipate about clients in a very rural community? What did you learn about? Probably learned a lot about rural communities, and we'll talk about it as we go through our content, but what's likely to happen?
Samaya.
No more chronic illness
Yeah, how come?
because they aren't able to get to like doctors and able to get good health care since they live far in the middle of nowhere.
Right? Right? Does somebody need to mute themselves with background noise? Let's see. That's correct. So the answer is A. They're more likely to have complex chronic illnesses for a variety of reasons, and we'll talk about that. But B, most of them do not have employer-related insurance, right? A lot of the rural jobs are hourly jobs that don't come with health insurance or dental insurance or vision or retirement or vacation days. A lot of this population doesn't have employer provided insurance. Okay. And C, they are more likely to have environmental chemical exposures. All right. The migrants working on the farms, working in rural population, working in agriculture with high exposure to chemicals. Okay. And then most of them, D, they will not actually have adequate access to physicians. What did we learn? What did you learn in your preparation about rural populations? you're lucky to have maybe one physician on board, right? There's just not a lot of access to physicians, specialty, and we'll talk about that as we get into our content. So yeah, they're much more likely to have complex chronic illnesses. The rural population does not focus on preventative care. Okay, so by the time we see them, they're usually at a more advanced stage of whatever they have going on. Okay, question number 2. Or does anybody have any questions about number 1? Okay, nurses developing a primary prevention program for members of the rural community, which intervention is appropriate. So what is primary? Let's review that. What's primary?
Preventing something before it happens.
What's
Preventative.
secondary?
Screening.
Early intervention, right? Screening. What's tertiary?
Treatment.
Treatment, management, treatment. So what's the correct answer in number 2?
The sun
Provide
exposure.
information or minimizing excessive sun exposure.
Yeah, you're trying to prevent something before it happens. Okay, so providing information on minimizing excessive sun exposure. And this is especially important in the rural community because many of the rural community migrant population work out in the sun. There's temperature extremes, heat, cold, right? So so B is the correct answer. That is primary, trying to prevent something before it happens. What is A?
That's secondary.
Okay, why is that secondary?
It's early intervention. It's a treatment.
It's a screening, right? Pap smear.
Screening.
It's a screening. What is C? Primary, secondary, or tertiary?
Tertiary.
Yeah, I need somebody to mute themselves with all that background noise. I'm not sure who it is. Thanks. What is C?
That's tertiary
And why is that tertiary?
because it's treatment for something they already had.
Correct. Correct. So they already have diabetes, right? And then what is D?
That's a screening.
Yeah, secondary.
Okay. Okay, because that's a screening, right? So the only logical answer is primary would be B, right? You're trying to prevent something before it happens. Okay, question number 3. Can you hear the background noise on my end of
No.
others talking? If you can, let me know, and I can quiet it down. Okay, a migrant farm worker presents to the migrant outreach clinic complaining of bilateral eye irritation, throat irritation, and cough. First of all, what could that be? What might that be?
Tuberculosis.
Nope.
Tuberculosis.
Pesticides. One of the
Pesticides.
things.
I
one of the-
picked that.
The
Oh.
pesticides, yeah, that's what I was saying.
And I picked that and I got it wrong. I picked the pesticides, I mean.
Oh,
And it said it was the TB, the tuberculosis, but I picked the pesticides.
Tuberculosis.
No,
okay,
the
Mike.
nice sweats. And
Well, if you go down to number 4, that's where
That's
where the
TB.
tuberculosis comes in. So
Yeah.
you guys, hang on. You guys checked D and it was correct?
No, the correct answer is B for number 3.
Correct.
yeah, number 3 is B. I did B.
Yeah,
Yeah,
the
B,
correct
B.
Yeah, oh
answer
yeah, I
for
did B too.
the correct answer for 3 is B. Okay.
Yeah, I picked B.
Okay, all right. Because if you're talking about a migrant farm worker, one of the greatest issues for them is exposure to pesticides. Okay, and in your readings and in your notes, it gave you some signs and symptoms of potential pesticide exposure, right? Bilateral eye irritation, throat irritation, and cough. So one of the things we would need to do is ask the farm worker if they have, if they are exposed to chemical pesticides at work. Okay, does everybody understand that? Okay, evaluate other family members for conjunctivitis. That has nothing to do with it. I mean, you could say that eye irritation could be a sign of conjunctivitis, but since we're talking about the migrant farm worker, we need to associate that with chemical exposure, potential chemical exposure. All right, we certainly wouldn't be requesting a physician's order for an antihistamine, right? Because we don't really know what's going on yet. Okay, complete a tuberculosis symptom screening questionnaire. Well, these particular symptoms don't necessarily align right away with tuberculosis symptom screening. Okay. Does everybody understand that? The hints in the question were migrant farm worker and what they're presenting with. Okay. Now, question 4 is a different story.
That's what I meant.
During a home visit, a nurse notes that the migrant farm worker family is living in a small house with several other families. And there's an important word in this question, which nursing assessment is a priority. Okay, so if you read about the migrants living in a small house with several other family members, what is that a potential risk of?
Tuberculosis.
TB. Okay. So the answer would be D, tuberculosis symptom screening questionnaire. Okay. And again, that comes from your reading. Migrant farm workers living in small quarters with lots of people, the risk of TB is increased. So the priority would be to start with a TB screening questionnaire. Right? Does anybody have any questions about that? Okay, question 5. Which statement reflects the impact of income on health outcomes? Hang on 1 second. I'm going to quiet this noise down. 1 second. Okay, sorry about that. It was driving me nuts. So whether you could hear it or not, it was driving me nuts. Okay. So, question 5. Which statement reflects the impact of income on health outcomes? Last week we talked about poverty. So what's the correct answer to this?
Low income increases the risk of chronic illness.
Okay. Does everybody agree with that? And why is that the correct answer? What happens?
They don't have
With
the money.
there's limited access to care, there's limited access to quality care. Going back to A, low income guarantees access to Medicaid. That's not necessarily true, right? High income reduces attendance to wellness visits. Actually, it increases. Okay. And then high income does not improve health outcomes. It actually does. Okay. Higher incomes create better access. Question 6, what should the nurse anticipate for a family living just above the federal defined poverty line? Just above, so slightly above.
Increased vulnerability.
Yeah. Did everybody get this right, or did anybody select anything other than A?
No, I didn't. I think so.
Okay, so if you're living at the federal poverty line or slightly above it, you are going to be vulnerable due to fewer community resources, right? Because once you kick above that federal poverty line, or once if you're at the poverty line or slightly above it, you are going to have increased vulnerability due to fewer community resources because you won't qualify, right? Question 7, which client is at the highest risk for adverse health outcomes related to poverty? We discussed this last week. Who is most at risk?
The 15-month-old infant. Without
Yep.
medical
Why,
history.
and why is that?
Because of his age.
Mhm. Mhm. Remember, children, right? Children are the most impacted.
vulnerable,
Some of you may have chosen C. Okay, the elderly is also considered a vulnerable population when it comes to poverty. But children are the most at risk. All right, so the 19-year-old is above the 18-year-old mark, so they're not considered vulnerable. 44-year-old male, no, but you have to look at the age. The child is the most vulnerable. Okay, and next would be the 68-year-old. Does anybody have any questions about that? Remember that because I think there's a question on the exam that has to do with age. So remember that. Children and elderly are vulnerable, but children are most vulnerable. Okay? Which would the school nurse expect for an impoverished adolescent? What's one of the biggest risks for kids, adolescents?
Them
Risk of
staying
dropping
in
out.
school.
School. Okay? Increased risk of dropping out of school, and we'll cover that in our content. There's a huge risk for dropping out of school. Okay? As far as reduced risk of unintended pregnancy, it's actually an increased risk. So it's the opposite. They don't have excellent use of adaptive coping mechanisms. Some might, but most don't. Okay, and then it would be decreased attendance to extracurricular activities. And remember, we're not talking about the normal adolescent, we're talking about the impoverished adolescent. That's an important word from that question. Okay. Which client is at the highest risk for homelessness?
The veteran.
Yeah, veteran. with
And why?
PTSD.
Why is that veteran? I mean, they're all at risk, but the question is asking who's at highest risk.
Because he lives
What?
alone.
Mm-hmm.
PTSD.
Mm-hmm. And they live alone. The other selections have somebody with them, right? Adolescent with substance addiction, but has a supportive family. Older child with a history of suicidal ideations. Adult with schizophrenia living in a group home. So we're most concerned about the veteran with PTSD that's living alone. Anybody have any questions about that question? And last, the nurse is working in an outreach clinic at a homeless shelter. Which client is prioritized? So it looks like, here's another, we talked about this last week. It looks like there could be more than one correct answer to this. So what do? You have to go back and read the question to see if you missed a word. Okay, so who needs to be prioritized? This is like the school nurse question of all the kids in the clinic last week. Okay, yes, everybody needs to be seen, but who is a priority? This is the same type of question.
The
A,
night
com-
sweats.
A.
What is it?
Night sweats and unexplained weight loss.
Right. What is that potentially a sign and symptom of?
TB.
Who said that? TB?
Yes.
Yes. And what in a homeless shelter, what are the increased risks for?
TB.
TB. Okay. It's not to say that the worsening foot ulcer and purulent drainage doesn't need to get seen. I mean, that's a potential sign of an infection, but we want to make sure we are assessing for a potential TB outbreak. That's the priority. Okay. All the other three need to be seen, right? But a potential TB outbreak is the priority for assessing. Does that make sense?
Yes.
What questions do you have about the quiz? On the ones that you got wrong, does it help going?
I changed my answers. Yes. Oh no.
Don't get me going on changing answers. We'll talk about that in a little bit. What's the rule of thumb for changing answers?
Don't do
Right.
it.
Did I?
Not
Yeah.
do it.
Yeah, don't do it, but okay. Okay, you got me there. What do you have? In order to change your answer, you have to convince yourself that you just simply, it has to be concrete. It can't be black and white. Like, oh, I think I remember reading this. I think I remember seeing this. I think I remember the professor talking about this. You have to be 100% sure that you have selected the wrong answer.
Mhm.
Okay, it's not I think. Maybe. Okay? Please don't change your answers. Please, unless you either clicked on the wrong answer by accident.
Never again.
Well, I'm not saying never again, but I'm just saying you have to be mindful when you change your answers. You know, I meet with a lot of students after exams and go through what they missed. And I very frequently hear, oh, I had that answer first and I changed it. And then when I ask, why did you change it? It's not a convincing answer. So I just ask you to be mindful about changing answers. Okay? What other questions do you have on the quiz? For the ones that you got wrong, do you understand why you got it wrong? Okay. Let's go into the we'll do some content and then we will review the concept guide. Okay. So, oh, I already have your notes pulled up. I want to pull up the migrant farm workers. Okay. Let's talk about migrant farm workers. When you think about a migrant farm worker, what do you think about?
They're poor. They don't have a lot of money and access to healthcare.
Okay. Where are they coming from?
All over. Oh, I mean, they travel a lot.
Yep. Always moving. I'd like to hear from others other than Abigail. Although Abigail, I appreciate all your input. Okay. What else did you learn about them in your preparation? I'm going between, just so you know, I'm going between your Canvas reading and the notes. Okay, so what else did you learn about them? There's a significant amount of questions on the exam 1 with regards to migrant farm workers. So I want you to have an overall perspective on the risks, the choices they make, the risks they have, especially kids. So tell me what you know about migrant farm workers. They're seasonal, right? There's probably a lot of language barriers, correct? They work in
Right.
extreme conditions.
Extreme heat.
Pardon me?
I was just agreeing, that's all.
Yep. Exposure to pesticides, right? One of the, go ahead.
UTs, I thought that was very interesting. I would have missed that on the test if I didn't read it. And then I did my own rationale, and it's because they don't have access to like toilets. So they tend to hold their urine if that's the case, and that
Yep.
makes them at risk for UTIs. I thought that was very informative.
Yep, yep. I'm gonna go to week 3. Okay, let me pull. Okay, so looking at our notes, they come to the US, right? Work on farms doing seasonal work. And then typically they go back home. Others move around. Right? There's typically language barriers. They don't know what kind of resources are available to them. Right? They typically have issues with transportation. They can't get around.
Yeah, like a sanitation.
Exactly. Exactly. And there may not be sanitation in the areas where they work. Right? Which is why the increased risk for communicable and infectious diseases and TB and all that, right? What do you do about a language barrier? Let's say you don't have any interpreters available and you're the rural health nurse. What do you do about language barriers? How do they understand? How do they communicate if they're feeling ill? What do you do?
Translator?
Well, what if you don't have one?
Pamphlets, boards to show how they feel,
Mm-hmm.
you know, those happy things like that.
Mm-hmm.
Okay.
We talked, or we haven't really talked about it yet, but think about the role of the community nurse working in the rural areas. And this is part of their population. Right? You're it. All right, you may be the school nurse in the rural population. You may be the migrant farmer nurse, taking care of people that are ill coming off the farms. You may be the clinic nurse. You may be it in the whole rural population, just like there may be one physician. It's super, super challenging. Okay. Female migrant workers. I'm looking at your notes here. High risk for sexual harassment or abuse. Lots of dangers for kids working on a farm, sun exposure, bodily injury, pesticide exposure. Housing is an issue for migrants. Right? Substandard, lack of sanitation, overcrowding. Right? Migrants are very much at risk for chronic disease. They don't understand preventative care, right? What else did you learn? What are their risks? Chronic diseases,
TB, yep,
TB,
Pesticide
diabetes,
yep,
heart attack,
yep, yep.
depression, if I know where to live.
Uh-huh. On your notes under the migrant farmer, the last paragraph before we get to rural populations, the last paragraph is about pesticide exposure. Okay. And I'm trying to pull that back here. Hang on. Here it is. Can you guys see that now?
Mhm.
Yeah.
Okay. Hang on. This last paragraph right here. You're going to be asked about this on the exam, okay? Because pesticide exposure is the biggest risk, you need to know the difference between acute and chronic. Okay, what are acute symptoms of pesticide exposure? What are chronic symptoms? Okay, so some acute signs and symptoms: memory loss, difficulty concentrating, mood changes, maybe some GI pain, nausea and vomiting, diarrhea, or skin rashes. Okay, but chronic, let's say you've been working on the same farm for 10 years. Okay, that puts you into the chronic risk. Birth defects, cancer, blood disorders, maybe neuro problems, reproductive issues, Parkinson's-like symptoms. Okay, so it's important for you to understand the difference between acute exposure and chronic exposure. Okay. I want to go back to make sure we didn't miss anything in the in here in the Canvas reading. So it gives you kind of a history. Who is the migrant population? Why are they seasonal? Okay. I think they estimate approximately 16% of the migrant workers are seasonal, or 84% of them are seasonal, predominantly Hispanic. Okay. What are some of the common health concerns specific to migrant farm workers and their families? Okay, we touched on some of these, but here's some specifics. Heat-related illnesses, right? You spend many hours in direct sunlight. Okay, exposure to pesticides, we covered that. UTIs, I think DeChantel brought that up. UTIs, lack of cleanliness, lack of toilet facilities while on the job. The other risks are bites from animals, insects, rodents, snakes out in the farm. And then the high susceptibility to infectious disease. We touched on TB. Okay, and then the other risk is mental health issues, depression, anxiety, right? These are influenced by the cumulative effect of constant relocation, poverty, and stress. Okay, and then the barriers. What are some barriers that prevent rural migrant farm workers from receiving health care? Okay, costs of health care. They don't have any insurance. This population doesn't have any insurance. Okay, shortage of healthcare services. Well, that goes in tow with the rural community. Right? Lack of culturally and linguistically appropriate services, unable to help with the language barrier, lack of information about their options, inability to get sick leave. Like I said, these jobs don't come with health insurance, right? So if they're sick and they need to take a day off to go seek a provider, they're not going to get paid. So they're less likely to do that, right? They're concerned about losing paid work time, social isolation, and exclusion. And then what about the undocumented workers? Right? Fear of how their immigration status will affect eligibility for any programs. Okay? The frequent relocation in the migrant work creates challenges to the continuity of care. Like, let's say they move around. Let's say they were diagnosed with something in one area and they move around to another area. Okay? That information is less likely to get transferred on. Right? And there's some good videos if you want to watch those with regards to the migrant population. Okay? So, questions about migrants. The next is rural populations. A lot of similarities to migrants. Okay? And this is in your rural populations. Let's cover that. What does rural mean? What's a rural population? Does anybody live in a rural population? In a rural community, or have family that live in a rural community?
No.
Anybody? Okay, so rural can be considered a remote farm, village, small town, in comparison to a metropolitan area. Right? In the past decade, the population has increased into rural areas. What's some vulnerability? What are some vulnerabilities in rural areas?
The
No
distance, the access to the places,
Mhm. Yep.
There's no
light,
structure.
water, all
Mhm.
this.
It also could take longer for like emergency vehicles and things.
Absolutely. Yep. So, rural areas tend to have a higher proportion of residents that are younger than 18 or older than 65. They tend to have fewer years of formal education with fewer college degrees. Interesting, more than one quarter, 25% of the rural population live in or near the poverty level. And 40% of rural children live in poverty. Okay. Fewer residents have insurance or adequate insurance. And more high-risk occupations. So think about it. In your rural community, you're working with agriculture, you're working with equipment, you're working with chemicals, much higher risk. So rural adults are less likely to prioritize their health care and engage in preventative activities. Okay, they're more likely to smoke, have higher rates of alcohol, substance abuse, obesity, much less likely to engage in the screening and wellness visits, blood pressure checks, cholesterol checks, pap smears. And they're much more likely to have chronic illnesses like heart disease, hypertension, arthritis, diabetes, cancer. Interestingly, nearly 50% of all rural adults have been diagnosed with at least one chronic condition. That's a large population. Oops, sorry about that. Let's see, rural adults tend to have poorer health, are less likely to seek medical care, are less likely to have health insurance, and have access to many fewer physicians. Interestingly, 10% of US physicians work in rural areas, right? And yet 25% of the population lives there. Okay? Rural populations have higher infant and maternal morbidity and mortality rates, right? Poor physician coverage. Rural areas lack specialty. They lack pediatricians, they lack OBs, they lack oncology, neurology, cardiology. You typically have to go down to the next regional drive. You need to drive to a regional hospital or regional clinic. Okay, rural residents have higher rates of persistent depression or at risk for stress-related diseases. And especially if you think about 25% of the rural population living in poverty. One of the, right here, rural areas have 4 primary high-risk industries: forestry, mining, marine-related fields, and agriculture. All these industries have a higher risk for health risks due to, we talked about it a little bit, machinery, car accidents, trauma, cancer, allergies, respiratory conditions, chronic illnesses. Okay. So a lot of issues, a lot of challenges for the rural population. Let's see. This is from your notes. Just want to make sure we covered everything. Barriers. Rural residents often encounter lots of barriers to healthcare that limit their ability to obtain the care they need, right? To have sufficient access, necessary and appropriate health care. Okay. They don't have the financial means often to pay for the services, such as health or dental insurance. Another big issue in the rural community is confidentiality. You know, what happens in rural communities? Everybody knows everything, right? Everybody knows your business. So a lot of times in the rural community, when you have issues such as substance abuse or child abuse, child neglect, domestic violence, a lot of people are unwilling to come forward until it hits a crisis level because they're afraid that everybody's going to know about what's going on. Right? They don't trust the privacy. Okay. And then there's also a stigma associated with conditions in rural communities, right? With mental health, substance abuse, violence. Talked a little bit about the barriers for rural areas, distance and transportation. They have long ways to travel to get healthcare services, especially with the specialty services, right? There's significant burdens with time, cost, being away from the workplace. And there's very little reliable transportation in the rural areas. Okay. Rural communities often have more elderly residents who have chronic conditions that require them to have multiple visits. Okay, that's challenging without public or private transportation. There's also workforce shortages. It's really hard to recruit people to work in the rural areas. Okay. They estimate that a shortage of healthcare professionals in rural areas can restrict access to healthcare by limiting the supply of available services. And this is I don't know if you've had a look at this, but look at this graph. This is in your Canvas reading. Okay, this is purple. I believe it's purple of the rural areas that have staffing shortages. Look at all that purple. There's a lot of rural communities across the country. Very difficult to recruit. And then health insurance is a big problem. And then believe it or not, internet access is a huge problem in the rural communities. Telehealth is increasing in the rural communities, so people don't have to drive. They can do telehealth, but in a lot of communities, this is still very, very limited. Another big issue is poor literacy, poor health literacy. Okay, health literacy is also a barrier to accessing care, right? What is health literacy? Right? It's the ability to understand the health information and the instructions from your healthcare providers. Right? This is especially concerning in rural communities where education levels may be low. There's a higher incidence of poverty. There's a diverse community, and maybe English is their second language. Right? So low literacy causes many, many issues, maybe make people reluctant to seek healthcare because of frustration. They don't understand. They don't understand how to communicate what's going on, let alone understand what the plan is going forward. Navigating the healthcare system for a rural non-speaking English person or family is extremely challenging. And we talked about the social stigma and privacy issues, right? Little anonymity. We tend to think of rural communities about having mental health issues, substance abuse issues, unintended pregnancies, chronic illnesses, privacy concerns. Okay. And we talked about primary care being the most basic need for all of us, and the lack of those services in the rural community. Okay. What types of healthcare services are frequently difficult to access? Face-to-face meetings, homebound visits, workforce. We talked about the shortage in workforce, time and resources required for, say, a home health nurse to travel to the rural areas to do her visits. Hospice and palliative care are very difficult, have lots of barriers in the rural community. And then mental health services, look at this graph. Health professional shortages for mental health in the rural community. Look at all the purple here. And this is the community that needs the most services for mental health. So there are lots and lots and lots of challenges in the rural community. Okay.
And that's sad because rural communities and like agriculture, I'm not say it right, but they really make up like our crops and things like that. So you would think that it would be, because I know these are facts that's been going on for years. You think that with them knowing all these things, they will be better with helping them get the help that they need, you know?
Right.
But it's like,
Yep.
what the heck? That's
Yep.
crazy.
Yep. The one
It is
thing
a
that
program
is,
for this, it is a kind of programs for this population.
say that again.
It is a program for this population.
Yeah. So if you read towards the end of your reading page, there are. What are some strategies to improve access to rural communities? There's a lot being done. A lot.
The numbers are still high though.
They're still extremely high. Extremely
Yeah.
So
high.
this means the budget is not enough for cover all these demands.
Say that one more time.
The government budget is not enough.
It's not, no, it's definitely not enough. I mean, I go back and forth between Denver and Wisconsin. So I'm currently up in Wisconsin, way up in northwest Wisconsin. Okay. And I live in an extremely rural community. Okay. There is nothing around here. Nothing. Nothing. For me to go and have blood work, I need to drive 45 minutes. Okay, there's nothing. I mean, everything that we just talked about happens in the community that I live in. Okay, all the issues. But if you read all the things that, all the efforts to improve, all right, delivery models, the regional hospitals and the rural community clinics and hospitals are trying to become part of larger healthcare systems. So that's a good thing. Affiliation with larger systems or networks. Efforts to improve the workforce. Okay, there's activities to recruit people. Telehealth we talked about. There's efforts to improve that. What can be done to help the rural veterans? Okay, that's being worked on. Okay, what's the difference? What is different about healthcare access for American Indians, Alaska Natives, Native Hawaiians? Where I'm in Wisconsin, I'm surrounded by Indian reservations. What's being done to help them? And then look at all the organizations that are working to improve healthcare access. Okay, so that is the good news. There's a lot of sad news about rural populations and the struggles they have, but there's also a lot being done to improve access, to improve healthcare. Okay? How private foundations are working to improve healthcare access. All right, so that's the good news. All right, so yes, it is very challenging to live in a rural community, especially if you have health issues. Right?
I cannot imagine. I've always lived in the city.
Exactly. And now that I've had exposure to living in a rural population, I mean, I'm fairly healthy, but I can't imagine having a language barrier, living below the poverty line, not having access to resources, not having access to a physician if I need one, or it's very, very, very challenging. Very challenging. So rural populations are, I mean, they're all over our country, and if we're not exposed to them, we don't really think about them, right? Don't think about them. and all the challenges that come along with them. Let's move into homelessness. We covered that. We covered the homelessness and individuals or families or communities that live in poverty in our introduction to vulnerability last week. But this is a little bit more specific. Okay, so I'm going to go through the notes first, and then we'll see what we didn't cover in your Canvas reading. All right, so before COVID hit, the percentage of Americans living in poverty was the lowest it had been since 1959 at 10.5%. After COVID, it went up to 17. So more than 48 million Americans lived in poverty after COVID. Right? And the child poverty rate was at 21%, about 5 million kids living in poverty. Okay, we know that poverty is defined by the federal government's federal poverty line. Okay, that is assessed every year. Okay, and is also associated with programs for individuals, families, populations living in poverty, public housing, food stamps, Medicaid, WIC. Okay, and here was the question on your quiz. Those just above the poverty line still desperately need the help, but no longer qualify, putting them in very vulnerable situations. What does poverty mean? 4, poverty, having insufficient resources to meet your needs, meet your family's needs. Those basic needs are considered food, shelter, transportation, and healthcare. Okay, what are some contributing factors to poverty? Unemployment, loss of retirement benefits. Maybe your company closed or filed for bankruptcy, and you don't have your retirement fund. Then the increase in the single-family households led by women. Okay, inadequate job training, inadequate education, weak enforcement of child support statutes, increasing number of children born to single women, especially teens. I don't know if I said this in week 1, but I'll say it now. Poverty is the leading cause of vulnerability. Okay, poverty leads to chronic diseases, chronic stress, mental health issues, high rates of chronic illness, higher infant morbidity and mortality, shorter life expectancy, more complex health problems, disabilities, higher rates of hospitalizations. Right now, complex health problems, chronic health issues are the highest expenditure we have in our healthcare system. A lot of people don't have insurance, the inability to pay for healthcare, lack of insurance, living in areas where healthcare is unavailable. Low-paying jobs often do not provide health insurance. Okay. Young children, this was another quiz question. Young children are at the highest risk for the effects of poverty. Okay, so that was your question about what should be prioritized. Young children at the highest risk. Why are they at risk? Living in poverty, lack of adequate nutrition, poor brain development, maybe exposure to environmental toxins, trauma, abuse, lower quality of daily care. All right, kids, and I saw this in the schools. Kids have more chronic disease, more nutritional deficiencies, more growth and development issues, developmental delays, maybe higher exposure to blood lead levels, and they're usually stuck in a poverty cycle themselves due to decreased opportunities of education. And those are the kids. About teens. Poor teens are more likely to have below average academic skills. Here's your other question, one of your quiz questions. Are 3 more times more likely to drop out of school? Higher rates of teen pregnancy. And more likely to suffer complications with pregnancy, whether it's lack of prenatal care, lack of family support, not telling anybody, premature labor, premature birth, maybe babies with birth defects. Okay, so poverty, I mean, just think about your own community that you live in right now. Think about the number of people or the groups of people that live in poverty. How do they survive? I mean, when I was in school nursing, I worked in many, many schools that had almost the entire population of the school lived in poverty. Hang on one second. Before I get into homelessness, I want to go to poverty. Okay, so let's make sure we covered this. This is your weekly reading. Covered that. This is a lot of history. Have a look at this. This talks about the progression of poverty in our country. So this is interesting. In the United States, people living in poverty tend to be clustered in certain regions, certain areas, certain counties, certain neighborhoods, rather than it be evenly spread across the country. Right? Research has shown that the poor living in areas where poverty is prevalent face impediments beyond those of their individual circumstances. All right? Higher crime rate, increased school dropouts, decrease in employment. So you have a high unemployment rate, right? So we know that the economic conditions in very poor areas create very limited opportunities, right, for people to become successful. We know that while the overall poverty rate is higher in non-metro counties than in metro, it varies significantly across the country. I mean, look at this poverty rates by census region. Look at this graph. Talks about the Northeast, the Midwest, the West, and the South. Okay, so non-metro, your smaller rural communities are in blue. Look at the poverty rates. Look at the South. And then here's poverty demographics. Poverty demographics by race and ethnicity. Look at that. Look at the discrepancies in that. I mean, it's incredible, the disparities. And then look at the poverty rates by family type. Again, incredible disparities. And so if you're working in the community, you're going to be exposed to all of this. You're going to be exposed to lots of individuals, lots of families, lots of subsets of the population living in poverty. Right? And then the last one is poverty rates by age group. Look at the disparities there. Look at the kids. Okay, so kids, poverty rates by age group, metro, non-metro. Look at the disparities, 25%, 24% versus 17, 22% versus 16. Those are huge disparities. Okay, and then it goes through how poverty is defined. So have a look at that. I would well, you're responsible for reading this, so I know we're skipping through it, but please have a look at that. Okay? So poverty is the point is poverty is a prime indicator of the health of individuals, the health of families, and the health of communities. Okay? Lastly, let's talk about the homelessness. What do you think? So you're driving around your community and you come upon a homeless encampment, homeless community. What do you got? What do you think about when you drive around and see this? What do you think?
So they have no job. They veterans.
There are drugs, mental health problems, illness,
they-
a lot of illness problems, poor, no, many like, how to say, people who coming from other countries, no work,
Mhm,
lack of the knowledge,
mhm.
or not talking the language.
Yeah, that's all. Yeah. Do you ever think about how they got there? How did they get there? I mean, everybody has their own story.
Right.
But do you ever think
All
about,
opinion.
geez, how did they get there? One of the things that I saw in the last 5 years of my school nursing career is the constant increase of homeless families with kids. Okay, especially after COVID. All right, when COVID cost a lot of jobs, cost a lot of people to either lose their jobs or have to quit to take care of their kids, right? Because the schools were closed. Lots and lots of homeless families, right? So what leads to homelessness? A lot of things, right? Maybe unemployment, lost your job, can't afford rent. Maybe there's been a health crisis or a mental health illness. Okay, substance
When I
abuse.
see homeless people, I see a lot of men.
You see a lot of what?
Men.
Yeah.
To me, the homelessness population is more men. Men.
Yeah.
Mhm.
Can you hear me?
Yeah. Yeah.
Okay.
I
Yeah.
saw many kids that run away from their house for the situations they are in their house, and they fall in prostitution or drugs addiction.
Yeah.
See a lot of veterans.
Yeah.
When I see people with like roaming the streets, like, and don't know, I think of mental health. Like, you know what I'm saying? They didn't get the adequate help that they needed. That's why they're on the streets, or their medicine took too long to interact with their symptoms. So now they're reaching out for drugs or anything to get that under control. Like, I don't know. I don't think anything bad when I think of homeless people, because you never know.
Exactly.
I've never seen any kids. Like,
Oh, you've
I've
never
never
seen kid? Yeah. Yeah.
No.
I saw-
Because most of them are adopted and in that places, so they remove
most
to the child cares.
Mhm.
of the kids are in the shelters. Well, it's like on the
Shelter.
streets.
Yeah.
It's a lot of men
Mhm.
sleeping on the streets.
Mhm.
The
Homelessness is
children are mostly in the shelters.
homelessness is growing across this country exponentially. Okay, all you have to do is turn on the news and look at big cities that have big homeless issues and know that lots of things are contributing to it.
It's so
Okay,
sad.
it's horribly sad. It's horribly sad. And what's the plan? What's the plan? So, as community health nurses, you may be working with the homeless. Okay. We know that, let me just go through a couple of other reasons why people may be forced into homelessness. We talked about a health crisis, substance abuse, domestic violence, right? And remember, the homelessness doesn't include just people living on the streets. Homelessness can also be an individual or family staying with friends or relatives or staying in temporary shelters. They just have no place to go right now, and they're considered homeless. So we had a lot during COVID, we had a lot of families moving in with relatives or friends they were considered homeless as well because there's no permanent place to go to be discharged. Okay. We know that for the homeless, at least on the streets, exposed to the elements, right? Crowded, unsanitary living conditions, nutritional issues, lack of sleep, chronic stress, mental health issues, alcoholism. All right, infectious disease, communicable diseases. We talked about the homeless shelter in one of our questions. Chronic diseases, trauma, right? Trauma is a major cause of death and disability in the homeless population. Gunshot wounds, stab wounds, head injuries, suicide attempts. And this is a very disturbing fact, but the average life expectancy for the homeless individual is 44 years old.
Wow.
As opposed to 78. Very frightening. So, as nurses, how can we help? It's vital we respect their individuality of every person. We talked about this last week in our introduction to vulnerability, right? Many factors can contribute to homelessness, and many of us are only 1 or 2 paychecks away from being unable to maintain our housing. Okay, it's really easy to stereotype. Okay, but we'll often be wrong when we stereotype. And if we stereotype and become judgmental, it will destroy any chance of a therapeutic relationship with any kind of a vulnerable individual or family, especially the homeless. Okay, make no assumptions. Let them tell you their story, who they are, how did they get there. Right, so establishing that trust, establishing that therapeutic relationship will only help in your ability to help them move or guide them out of the situation they're in and towards more stability. Right? And here's your weekly reading. We know the homelessness affects everybody, right? Men, women, children, all races, all ethnicities, all occupations. It's estimated that over 600,000 people in the United States are homeless each evening. And a third of the 610 are families. Talked about that. Homeless individuals are without permanent housing. We talked about that. Risk factors. I think we covered that. We know that homelessness has very negative impacts on kids. Okay, infants born into homelessness have low birth weights, 9 times more likely to die within the first 12 months. We saw this in the schools that the homeless kids are much sicker, 4 times sicker than your average kid, whether it's infections, ear infections, asthma, iron deficiency anemia, respiratory infections, ear infections. All right. Also much more likely to exhibit delayed development. Twice as likely to have learning disabilities. So what's our initial approach? We started talking about that. Identifying the homeless patient and those persons and families at risk is a priority. How do you do an outreach visit? Right? An outreach visit is typically the first contact with the homeless individual or family. All right? During the visit, this is if you were working with the homeless, focus on demonstrating genuine interest, empathy, respect, non-threatening, non-judgmental. Okay. Then it goes through some issues that homeless people will exhibit: cardiovascular disease, dual diagnosis, maybe mental health with substance abuse, A lot of homeless have cognitive disorders, TBIs, injuries and violence. This is a good table to read through. Considerations in healthcare for homeless people. Logistical issues, clinical issues. Here's another good table, table 2. Considerations for medication use for homeless people. Whether it's for respiratory, others for mental health, substance abuse. They're going to have skin and foot problems being exposed to the elements. Resources, that's key. As a community nurse working with the homeless population, we need to be very well educated and aware of whatever resources in your community that you have. A lot of people, a lot of students did their discussion 1 question on the homeless population. Okay. If you'd like, take that topic and expand it to your vulnerable populations project that's due in week 10. We've already started. And a lot of students do their vulnerable populations project on the homeless population. One of the criteria, it's in the rubric, is to identify resources. What resources in your community are there for the homeless, or there for the teen pregnant mom, or there for the elderly, whatever you choose to do. But knowing your resources for the homeless population, knowing your gaps in service, what is not available for them, right? Here's a whole list of them. Okay. So homelessness is a big focus in this class. There's a lot of there's homeless people, individuals, families in every single community you live in. Are there not? Every single community. Who is working with them? Who's working with these families to get these kids into pediatrician visits, get them immunized? Who's working with them to get them into, if they have comorbidities, substance abuse, alcohol issues? Who's working with them to get them into detox or get them into rehab? And this is one of the functions of community health nursing, working with this population. So it's hard. It's hard. This is a very vulnerable, very, very vulnerable population that is affecting all of our communities. And, whether you work in a urgent care, whether you work in a medical office building, wherever you work, you're going to be, not dealing with, that's the wrong word, but you're going to be engaging with the homeless population, right? Thoughts on the homeless population. Does anybody have any interaction with the homeless population in your community? Or any resources that you work with in your community to assist the homeless population?
Well, in
My
New York,
church, we give away clothes and food. Sometimes we've been around the neighborhood passing out food till it's all gone.
Awesome.
We try to do stuff like that.
That's awesome. Yeah. I worked really closely with our homeless families in the schools that I was in and did the same thing. Children, there's a lot of homeless children. A lot of homeless children. So, and in community nursing, you're going to be exposed to it. So, and especially if you go into school nursing, the effects of homeless kids are very apparent in the school setting. Lots of risks, lots of deficiencies. So, kind of a sad subject to talk about, but when you think about all the homeless people living in all of our communities, it needs to be talked about and addressed, right? So those are our 4 topics for today. I didn't get to the study guide. Let me just, do you mind if I jump to it for just a couple of minutes? I just want to, you guys see that? Or did I? Hang on. So your study guide, real quick, and this doesn't take the place of you attending a review. Okay, so I've broken it down. I've given you all the information you need. You've got concepts week 1, concepts week 2, concepts week 3. I'll copy and pasted all your readings for week 1, week 2, and week 3. So it's kind of a cheat sheet. Okay, the exam is no different than your other classes. 50 questions. There's 5 math questions. Okay, there's some select all that apply. A lot of priority questions. Okay, what's the best? What's the first? What's the initial? What's the greatest? What's the least? Right? You know what all those priority words mean, right? 75 minutes, 50 questions. Math is pretty basic math. Okay, I sent you lots of math resources. If you struggle with math, I would highly encourage you to, I sent you several, but I'd prioritize Professor Bogart's tutoring session. It's in your week 1 announcement. She does a tutoring session, and there's handouts for it on basic math. Okay, basic calculations, conversions, setting up an equation. So if you struggle with math, go to Professor Bogart's tutoring session. Okay. I've put together this concept guide based on a couple of things. Your weekly notes that I've sent, you got 3 weeks worth of weekly notes. Your readings that come from the book and from Canva and from your modules, and my lecture notes. Okay, so I put that together. It's a really easy guide to follow. I have week 1 broken down with the 4 concepts, all in order. Okay, I have week 2 broken down, all in order. Okay, a lot of this information you've already seen in here. Okay, whether it's from your weekly notes. What this is a shortened version. So now your weekly notes were to cover the big picture of the concept. Okay, now I have targeted each concept even more directly. Okay, so my suggestion is that you review this concept study guide. If you don't understand or need more information, go back to your weekly notes and look at the bigger version. Okay? If you understand the concepts in this study guide as is, you will be fine on the exam. You'll be absolutely fine. Okay? So start with this guide, then you use your weekly notes as a backup. If you still need more information or more knowledge to understand it, go back to the reading associated with this concept. Okay? And remember that these exams are applying your knowledge to clinical judgment. So your exam questions are going to be clinically focused. Okay? So, you know, when we get to school nurse, what happens in the schools? When we get to common childhood ailments, a kid presents with conjunctivitis, a kid presents with lice, whatever. Okay, they're clinically focused. So you're taking your knowledge and making judgments from that. Okay? So my suggestion would, like I said, would be to start with this concept guide. Okay?
Thank you. Thank you.
And if you run into problems, if you come to a review, I'm going to cover the concept guide. Okay? You'll also have the recordings for it. But like I said, if you have a good understanding of this concept guide, you will ace the exam. And I'm not asking you to memorize it. Okay. As you read through it, there's no need to memorize it. You should have an understanding and be able to apply it to a client. Take your knowledge, make your clinical judgment. Right? So this isn't about definitions anymore. Those exams are long gone about definitions. This is your next gen format, taking your knowledge and applying it to practice. Make sense? You guys will be fine. You guys will be fine. Okay, so like it's in this concept guide, a lot of this information may be repetitive from your notes. And that's okay. That's okay. It's just reinforcing. But it's also a much more limited guide than your notes. Okay? The weekly notes are intended to give you a big picture of the concept. Everything you need to know about the concept. The study guide is meant to identify what are the most important points about that concept that we really need to know. That's how to think about it. All right? Does anybody have any questions? Is that helpful?
Thank you.
And then your reviews are coming up this week. I have one tomorrow. I think there's one Thursday and one Sunday. So if you can get to them, great. If you can't, you'll get all the recordings as well.
Can you are the instructors, other instructors ID?
It's already in I already sent out their master, it's called the master review schedule. I sent that out 2 days ago, or maybe Saturday, maybe. And it has all the instructors.
Like their IDs, their Zoom IDs?
Yeah, it has
Oh,
when they're giving their exam reviews and their Zoom IDs on the right-hand side.
okay, thank you.
I sent out all the groups yesterday. Okay, I did the best I could to keep it within campuses. Did everybody get that? So
I wasn't, but it's okay. It's not
yeah,
my
it's in
camp.
there. It's in there.
Yes, I
You
got
got
it.
your groups in there.
Yes, and announcements.
Yep, you
Yes,
got your,
it is announcements.
yep, that's all in there. So yeah.
Mrs. Marble, I
Mhm.
know you said week one that we're gonna be going over the HESI prep 15 minutes after every class. And I
Well,
was
we haven't
wondering where,
really now, after this week, there's content on the HESI prep. The first couple of weeks were more of a introduction, but now we have the migrants and we have the farm workers and the homelessness. That is on your HESI prep.
right, and
Okay.
I'm filling it in or whatever. I just want to make sure that I have correct information or whatever.
Yep.
That's why I was wondering if you were gonna go over it next week
Yeah,
or
we're just kind of out of time, but
Right.
you should take the opportunity now that, let's see, 1, 2, 3. So now we're finished 3 weeks. This is what your exam is going to be on. This is a good time to pause as you're preparing for your
Okay.
exam and go to your HESI study guide and see there is a little bit you can fill out, not a whole lot, but the contents that we covered today are in your study guide or in your
Okay.
HESI prep.
Right.
Okay. And we'll spend some time on that. We'll spend some time on that after the exam week. All right, because next week's your exam. And then when we come back in week 5, I'm going to cover week 4 and week 5 together. And then we'll stop and we'll fill out what we can, because there should be quite a bit at that point that we can
Right.
fill out. So I will pull that up in week 5. All right. How does that sound?
Great.
Okay. All right. Well, you guys have a good rest of the week. Good luck with the rest of your classes. Reach out to me if you need anything. Okay.
All right.
All right.
Talk to you later.
All right.